Hello, welcome back to Political Science 400-500C, Public Policy for Health Security and Resilience. My name is Nathan Myers, and this is a presentation for week 4. The focus of week 4 is going to be on risk communication. So all of the readings that you're going to be looking at are going to be focusing on the idea of risk communication and its importance to dealing with a public health emergency like avian influenza, particularly if it were to reach a pandemic level. So a couple of the resources that are provided for this week are a couple of articles that I co-authored with some colleagues from the Department of Communication here at Indiana State University, Natasha Rascone and Melinda Johnson. So I thought these would be hopefully interesting and useful at discussing and illustrating some concepts related to risk communication. So this first one is a little bit more specialized because it's focused particularly on laboratory research having to deal with highly infectious pathogens that reside in animal populations, but can also potentially break through to human populations. So avian influenza would definitely fall into that category. So it's focused on these biosafety level 4 laboratories, which are laboratories that are dealing with the most dangerous types of pathogens, and how the work in these laboratories after the COVID-19 pandemic have become the subject of some misinformation and conspiracy theories. There's still the debate about whether the origin of COVID came from a wet market in China or a lab in China. And so there's a lot of controversy about any type of research going on here in the United States having to deal with potentially dangerous pathogens, and whether the work is about finding cures or developing weapons and things of that nature. So it's looking at risk and crisis communication through what's called the One Health framework, with the idea of One Health focused on the connection between human health, animal health, and the larger environment. So the key term that's probably going to be most applicable to you as you think about the culture-centered approach, or as you think about addressing the avian influenza pandemic, is going to be this idea of a culture-centered approach, because regardless of what type of community you're representing, that's probably going to come into play. So some key points that are identified at the very beginning of the reading: the increasing spread of mis and disinformation in the area of infectious disease research necessitates that facilities like biosafety level 4 labs more actively and productively engage with the public. So, looking at it not only from the infectious disease preparedness and response perspective, but also the community resilience perspective, there's value in proactive engagement. So, one of the arguments made in the article is that scientists, particularly in the communities that they're doing their research in, need to be more regularly engaged with the community, communicating about the work that they're doing, explaining the level of safety, explaining the level of value to the larger community, so that there's not this vacuum of information that's filled with disinformation and misinformation. The second key point is that the One Health model is a useful way to frame engagement because it provides opportunities for members of the public to directly engage in activities like surveillance, which can increase buy-in regarding public health preparedness and response activities. So we've talked about outbreak data and biodetection in previous discussions, but that is one of the roles that the public can actively be involved in is public health surveillance. You know, for example, with avian influenza, farmers should be actively on the lookout within their poultry flocks, within their cattle herds, you know, looking for any signs of illness and reporting those signs to veterinary specialists, obviously, but also public health authorities if they think there's any potential risk of avian influenza infection. Particularly, you know, they want to keep, you know, any laborers working on the farm safe. So you want to make sure if there's signs of infection among the animal population, that any humans that are coming into contact with those animals are being tested for infection as well. And the third point, when engaging with the public, it's important to remember that particularly on issues like infectious disease, a culture-centered approach that takes into account existing perceptions, attitudes, and knowledge is important to establish a relationship of trust. So if there is an event involving one of these labs where a pathogen escapes from the lab, and there have been documented situations of this happening in the United States, fortunately on a pretty low level, a pretty localized level. And it's happened in other countries as well. It's happened in the UK. So this is a possibility. So in those types of situations, approaching communication with a culture-centered approach that understands the public's perceptions about science and research, and potentially misperceptions, their attitudes and their knowledge, and taking those factors into account when engaging in communication. So that's the point that I'm gonna probably focus on more moving forward. The article talks about the need to gain and keep community support for biosafety labs. There's been recent policies. The Trump administration has basically put a moratorium on certain types of research called gain of function research because of concern that gain of function research contributed to the COVID-19 pandemic. And that's led to a lot of concerns about stoppages on other types of research. The National Institutes of Health, their budget's been significantly reduced. So there is a lot of reduction going on in scientific research in the United States in general. So it's important, to the degree that research is still ongoing, that scientists do what they can to keep the public on their side, that scientists and people who operate these labs have a relationship with the media and know how to work with the media to engage in, before anything happens, work on risk communication strategies to communicate to the public that there are potential risks, but these are the things being done to prevent the worst from happening. And then if something does happen, developing strategies for crisis communication so that the public has good information and knows what to do to protect themselves, to protect their families, to protect their employees and other stakeholders. So, involving key stakeholders within the community. In this case, we're focusing on veterinarians, farmers, ranchers, because, we're dealing with zoonotic diseases or diseases that originate with animals. And obviously with avian influenza, these would be particularly important groups to be collaborating with, both in terms of risk communication and also crisis communication, because they're most close to the risk in terms of regularly interacting with animals, but they're also going to be the ones that are going to be on the front lines to a crisis response if something were to happen. Because if there's a leak from a laboratory that ends up getting into animal populations, they're likely to see it before anyone else does. The section on surveillance as a tool just kind of relates that idea. One of the big controversies with COVID-19 was how widespread COVID-19 actually was, how infectious, how deadly it actually was. There was a lot of questioning of the data from people. So the basic idea in this section is the more that we can get the public engaged in surveillance within their communities, when there's any kind of public health emergency, infectious disease threat, the more likely that we can promote and build trust in the data that's being provided. Because more people in the community will see firsthand how that data is being created. They'll know that people in the community are engaged in the creation of that data, and they'll be less likely to see it as information that's being promoted from the federal level or the state level and is being misrepresented. If there's people within the community that are helping to develop this information, it's more likely to be trusted than it is if it's coming from an outsider. So one of the big recommendations in the article is that BSL-4 Lab should create teams of communication specialists who interact with the local community to create the best possible risk and crisis communication strategies. So just these labs need to be much more proactive in both having these strategies in place, but also developing these strategies in connection with the community. Because the people who work for the lab need to have an understanding of how these messages are going to play to people in the community, how they're going to resonate with people in the community. And people in the community need to have an understanding that these strategies are coming from an honest place. Sometimes there's a perception that the government is just telling people what they want to hear and they're not really telling people the truth. So if you're actively collaborating on developing these risk and crisis communication strategies, it may help to downplay that skepticism that people aren't being given the full truth. So in terms of just providing basic definitions, risk communication used to be viewed primarily as the dissemination of information to the public about health risks and events, such as outbreaks of disease. Thinking of this has now evolved as social science evidence and new communication and media technologies and practices have evolved in the 21st century. The risk communication should be something that goes across all the phases of public health emergencies, preparedness, response, and recovery, and should involve relationship building. Again, it should be people in the labs working with the communities, working with the media, maintaining a proactive, transparent, participatory communication approach. Transparency and engagement are sort of key values that should be adhered to. And then crisis communication involves timely action in response to a crisis. That includes enacting a plan for information dissemination during the crisis, because there's going to be a high demand for information. And as we saw during COVID-19, if good information is not coming from reliable, trusted sources, people are going to step in and fill that vacuum. And some of what fills that vacuum is going to be misinformation that could be potentially dangerous. So the idea of a culture-centered approach The culture-centered approach is value-centered, is built on the notion that the various ways of understanding and negotiating the meanings of health are embedded with cultural context and the values deeply connected with them. So the voices of people in the community need to be heard and integrated into the risk and crisis communication strategy. So whenever you're talking about problems, priorities, and possible solutions, those have to be communicated, understanding how they're going to be perceived in the community, and then there needs to be a dialogue about those issues, taking into account these cultural values and perceptions. So Dutta defines the CCA as an approach to health communication, which questions the constructions of culture in traditional health communication theories and applications, examines how the latter have systematically erased the cultural voices of marginalized communities in their constructions of health, and builds dialogic spaces for engaging with these voices. So the CCA approach is particularly aimed at populations that could be marginalized during a public health emergency. For example, during the COVID-19 pandemic, there was a lot of discussion of how the concerns of frontline employees, like the people who were working in stores and restaurants and places like that, there was a concern that their voices were not being incorporated, particularly if those individuals belonged to a racial minority group. So based on the culture-centered approach, one of the aspects of a risk and crisis communication strategy would be trying to, take into account the perspective of those quote unquote essential workers, people who are not making a lot of money but are still on the front lines, putting themselves at risk. And if they belong to a racial minority group, that puts them at even greater risk if they do get sick of getting very ill and being more severely affected. So your crisis communication, risk communication strategy should take that into account. Looking particularly at avian influenza, one group that's been mentioned a lot are farm workers. A lot of them are immigrant laborers who work on chicken farms and cattle farms, and are potentially being exposed to the virus more than any other group. And if we're going to see human transmission, human infection in the United States, it's probably going to be from those individuals. So it'd be the challenge of incorporating their voices into any risk and crisis communication strategy, from the standpoint that some of them are not wanting to actively engage with government officials. They don't want to engage with the health sector any more than they absolutely have to. So it's a tricky thing if there were to be a major avian influenza, or if the avian influenza outbreak in the United States became worse and reached even sort of pandemic levels. That would continue to be a challenging group to sort of integrate into this CCA approach. And then looking at farmers in general, there has to be the recognition that, as we've discussed in previous presentations, farmers are very much looking at this as a threat to their livelihoods, because you've seen examples of culling around the world when it comes to avian influenza. Culling's been used in the United States as well. So the idea of monitoring for infectious disease threats, puts farmers on edge, because if they're found to have an infection, could the government come in and say they have to slaughter all of their animals at a loss to them? If the animals are all slaughtered, are they gonna receive any kind of compensation for that? And then when you add in the dimension of this could be not a naturally occurring phenomenon, but something that emerged from a government laboratory and could be perceived as something that's actually the government's responsibility. That adds a whole other dimension to the conversation and could exacerbate the fact that people already have a low level of trust for the government in rural areas. Another thing, the reason why the CCA approach is considered to be value is, it prevents, sort of a cookie cutter approach to, dealing with risk and crisis communication, recognizing people's cultural values and perceptions and things, helps, not only helps you to avoid potential tripwires, but also makes groups feel more heard and feel more seen. And if particular groups feel like their needs are being taken into account by the authorities, they're more likely to be responsive. I remember one example, there was some communication campaign that was being aimed, I think it was being aimed at the public at large, but particularly they were targeting Indigenous or Native American groups. And one of the big messages from this public health campaign was, you could end up dead, your family could end up dead if you don't, pay attention to these potential risks. And one of the sort of cultural issues with that is among Indigenous Native American people, death is not viewed the same way as it is by a lot of other cultures. It's not viewed as negatively as it is by a variety of other cultures. So that message doesn't resonate in the same way, and in some ways could be perceived as offensive. So that's one of the reasons why you need to take culture into account when you're doing your communication. Not every group is going to see concepts like death in the same way. This idea of the communication complex. There's two fundamental principles here. Everything is systemic, and communication is bioactive. So the idea of everything being systemic is the idea that team members, communication team members are going to be delivering information to people in the community. So the communication team is going to impact the functioning of the community and the behavior of the community members, but the community members are also affecting the communication team as well. So there's a reflexive relationship. So, whenever human beings are interacting with each other, there's certain physiological effects to that communication. Communication is not just, somebody says something and we hear it and we intellectually respond to it. Oftentimes, it'll affect heart rate, it'll affect breathing, and those sort of involuntary effects that sometimes we don't even understand or aren't even aware of at a conscious level affects the way that we hear that information. If somebody says something to us and it makes our heartbeat faster and it changes our rate of breathing, we could kind of shut down and stop listening to those individuals because it's sort of a fear response. So it's important to recognize that when people are communicating, the tone that's used, the language that's used can be very important. just people's physical body language, all of these things are important to keep in mind. Because it's a two-way communication. So if people in the community are responding poorly to the risk and crisis communication team, then they could become defensive, and then it becomes kind of this feedback loop where communication can potentially break down. So it's important to avoid those kinds of situations as much as possible. And then community engagement talks about 4 ways communication impacts engagement: understanding, preparation, management, and empowerment. And we've talked about this ahead of time, that if, for example, biosafety labs, if they have these risk and crisis communication teams that are in place before anything happens, they've been working with the community ahead of time, they've developed relationships. Through this process, people in the community will have a greater understanding of what's been going on in the laboratory, what sort of viruses they've been working with, what the potential dangers associated with those viruses actually are. So they won't overestimate the risk, but they also won't underestimate the risk. People will hopefully feel better prepared on both sides through this engagement, this regular engagement before any emergency takes place. When a crisis does emerge, the management of that crisis should be easier, because again, people know each other, people aren't introducing themselves to each other at the beginning of the crisis. People know each other, people know who to go to for certain resources or for certain information, or to fulfill certain roles during the crisis. So the management is going to flow easier, and people feel more empowered. If there's engagement with the community, hopefully the community will feel more empowered. They won't feel like this is just something that's being thrust on them, and they're just kind of playing the role of victims. They've worked through these issues ahead of time. They've thought through some of the potential effects, and they know better how to talk to their families and their coworkers and other people in their community, and that they have more of a role to play in dealing with the situation, other than just reacting and just doing what the government or the authorities tell them to do. It notes here, according to the World Health Organization, a risk communication plan should include a plan in advance, the building of trust, engaging communities, using multiple channels, and monitoring, evaluating, and adjusting as needed. So I think a lot of those, we've covered already. There needs to be a collaborative plan developed ahead of time, trust building, community engagement, using multiple channels. So if we're talking about, using the media, that could encompass, social media as well as television, radio, newspapers, and, other media as well. If it's putting up, even if it's like putting up flyers or things like that, whatever channels can feasibly get information out, taking advantage of those, recognizing that, not everyone, looks at Facebook or looks at certain social media. Not everybody's going to read the newspaper. So you've got to be as wide ranging as possible. And also take into account things like, different languages and things of that nature. So proactive communication plans, keeping in mind the complex nature of communication, developing a communication plan is necessary for situations where risk is a concern and before the crisis occurs. So 6 areas of communication that require planning: internal communication, spokesperson, representative communication, media relations, community building, education, and information sharing. So there needs to be internal communication. The aim of internal communication being to determine what constitutes a crisis, who to contact, and what are the first signs. So those sort of initial responses, you know, what is the crisis, who needs to be alerted, and you know, how do we verify that it is in fact going on? So once you've done that, you know, we've talked about, you know, media strategies, you know, having a key spokesperson or spokespeople in place. You know, somebody should be in charge of overseeing what information is going out to make sure that, you know, there's not miscommunication, or to make sure that there's not contradictory information that's going out. Dealing with the different types of media, whether it's television, radio, print media. You know, somebody should be monitoring social media to watch for misinformation and disinformation and correcting that as necessary. Community building, again, you know, part of the communication planning process is, you know, bringing people into it and giving people a role to play, and you know, building a sense of confidence that, you know, if something happens and these messages are coming out, that these messages should be paid attention to and shouldn't be overlooked. And obviously, you know, you need to educate the public about the level of risk and how long it's likely to last, and then sharing new information as it comes about. So hopefully the education, you know, comes before the crisis actually occurs. You know, laboratories should be educating the public about what's going on and what the potential risks are ahead of time, so that they know that basic background information. And then the information sharing will come about as the crisis is kind of unfolding, and sharing new information as it develops. So I think I'll go ahead and stop here for this presentation. I'll address other resources that I provided regarding risk and crisis communication later on. But in the meantime, thanks very much for watching, and let me know, obviously, if you have any questions. So thanks very much.